healthier you, making diabetes history on Guam.
Presented in partnership with Kalu Select Care and Paradise Fitness Center.
Afternoon, everybody. Welcome back to The Link. As we've been doing over the past couple of days, we are promoting diabetes awareness on our program. It's part of our campaign with AI Health. And as you know, over the weekend, we started off with hearing from Governor Lilian Guerrero. Also, we heard from several different members of our community involved with prevention and making sure that we're eating the right foods. Today, we are talking about technology today with Dr. Erica Alford. She is with the American Medical Center. She's also an AI Health advisor, a member of the AI Health Clinical and Technical Oversight Board and principal investigator for diabetes study on Guam. She practices at the American Medical Center, as I mentioned. She's also a leading endocrinologist right here on our island, and she was born and raised here. Also with us in the Zoom room, we've got Dr. Juan Espinoza. He is with AI Health. He's the Chief Medical Officer and Chairman of the AI Health Clinical and Technical Oversight Board. The guiding principle of Dr. Espinoza's work over the past decade has been that data and technology have the potential to narrow the health gap faced by underserved communities all over the world. So thank you both for joining us this morning.
Of course, thank you for having us.
Thank you for having us.
I'm very pleased to have the both of you.
Right.
Well, I guess I wanted to start and just to kind of contextualize this, both of you doctors have a vast amount of experience with and appreciation for the use of data when it comes to, making decisions, furthering your research and your practice and everything like that. Can you kind of talk about what that means as far as the opportunities when considering large amounts of evidence when it comes to medicine?
Yeah, I'm happy to chat about that. So, when we think about data, it happens at different levels. So I think that there's at the individual level. So on a specific patient, how much information do I know about you so that I can help you achieve your best health? And that might be information that we gather during our interview, during our visits, right? Taking the history and understanding what's going on with you. It might be data that we gather from taking your vitals, from taking blood, from running certain imaging studies or diagnostic studies. And what's really incredible is that diabetes is this uniquely quantifiable disease, both the disease process, so the changes in blood sugar, as well as the treatment. We can really measure in very, very finite, granular ways. And so it's this fascinating opportunity to really bring to bear advanced techniques and data gathering and data analytics to really change the life of one person with it. But if you go beyond one person, then we start thinking about what is the health of communities? What is the health of the population? We start thinking about concepts of population health and how do we gather information about a lot of people? And how do we make decisions about how do we change the healthcare that we deliver or the environment that we're in so that the population of people can move together? And that requires a whole different set of data. So not just those individual level data points, but really thinking about data from all of these people and then those contextual data points. So, do you live in a food desert? What is the air quality? What is the water quality? Really thinking about communities more holistically. And it poses certainly some data challenges from the collection and analytics standpoints, but I think the potential to really do something meaningful to improve the quality of life and the health of individuals and populations is what's most exciting about it.
And so, Dr. Alford, as a clinician and everything, empowered with all of this data behind you and everything, does it speed up the process of being able to diagnose and then treat and monitor your patients? I'm sure it would, but how different a paradigm shift has this been, considering what the way medicine maybe was practiced like a half century ago?
Oh, absolutely. It has shifted medicine leaps and bounds. I've had the pleasure of working with some patients with diabetes who had diabetes at a time where insulin was delivered through glass vials that had to be boiled before it was delivered. There were no glucose testing kits where the only thing that they had was a urine dipstick to see if they had a lot of urine in their, a lot of sugar in their urine or not. They had no clue what their blood sugar was at any given moment. And in order to get that data, they had to go to a lab and get their blood sugar tested. We have made huge advances as much as people with diabetes hate poking their finger to get a little sample of blood to check what their blood sugar is, that has changed life with diabetes tremendously. Just being able to know so you can make a change in your life has improved the quality. Now we have devices that continuously check your blood sugar so that we know what your blood sugar is doing minute to minute, second to second. And so this has really helped change people's lives. Just knowing that information makes it easy to say, you know what, that meal was not good for me. Or, hey, you know what, that exercise routine was fantastic for me. I'm going to be motivated to do this more and more because it's really helping me. Just having all that information for the patient makes a huge difference. Now, coming as a clinician who has been a practicing endocrinologist for 10 years and a physician for the last 15 years, it has made such big changes because before it would be check your blood sugar once, twice, 3, 4, 5 times a day and write it down for me. So we had those time points, but that's assuming that the patient could get around to it. Life gets in the way. And then we would use that information to help adjust in medications.
And assuming they don't fudge the numbers just to make the doctors look better.
Just so you know, patients, the doctors can figure it out. I've actually, it's pretty obvious for us. So don't bother lying because it does not help you whatsoever. We can figure it out.
Thou shalt not lie. I'm sure I read that somewhere before.
Correct. and it's really true. We have your lab data, we have your numbers, and if you produce your glucometer, it's not that hard to figure out. So just be honest, because that's the only way we can treat you. But knowing information, we check a value called a hemoglobin A1C. Hemoglobin A1C gives us an average of what your sugars have been over the last 3 months. It gives us an idea of your overall diabetes status. The problem is it's an average. So if you have lots and lots of super lows and lots of really highs, it averages out to pretty good for the most part. However, the super lows are really bad for you. The super highs are really bad for you. So we want to narrow down that range so that your blood sugars are in a very tightly controlled arena. With blood sugar testing, that's throughout the day, a point here, a point there, we might be missing the highs, we might be missing the lows, and so we never know. I've had patients who go from 30 to 500 all in a day. Normal's about 70 and 80. Diabetics, we want you around 100, 120. And so they average out great, but they're definitely not okay at 30, and they're definitely not okay at 500 or 400. So we want to avoid that. We've had patients where their overall average looked really bad, but their point of care testing looked really good. And we throw on these continuous glucose monitors and we find out why there's, the numbers are not correlating. So technology has really advanced how we treat the patient, and just being able to continuously see what a patient's blood sugar is doing can really help us adjust medication, adjust lifestyle, adjust exercise pattern, adjust eating patterns so that we can really help patients control diabetes.
Mm-hmm. And you kind of are touching on it, and some of it is a little bit above my head, but if you a little bit more about the technology, the disease monitoring devices that are out there today. I know that you had some examples.
Absolutely. So I think everyone is familiar with the point of care testing that we use, where you poke your finger, you get a little sample of blood and you put it on a kit, and it tells you what your blood sugar is at that point in time. Now we have these beautiful machines called continuous glucose monitors. And what it is there's a little sensor that goes, oops, that one falling down. This is the one we play with all the time. But there's a little sensor that gets placed right on top of your skin. Depending on the brand, it can be on your abdomen or on your arm. And there's a little tiny filament that is the thickness of about 2 hairs that stays underneath your skin. Now, patients always panic thinking that I'm going to leave a needle underneath their skin, but that does not happen. There is a nice little device that has the sensor already attached to it that contains the needle, where the needle goes in really quickly, leaves the filament behind, and the needle pulls out. So the needle stays here and you toss this device. And so underneath your skin, there's a little tiny filament that continuously checks your blood sugar. And depending on the device, there may or may not be a transmitter that tells your reader or your receiving device what your blood sugar is. Now, your receiving device could be your smartphone as well. And the nice thing with the devices that transmit the blood sugars is if your blood sugar is rapidly going down or rapidly going up or too high or too low, it sends you a warning saying, hey, got to go check your sugar, so that you whip out your phone or your receiver to see what your blood sugar is at the moment.
Doctor, I'm sorry, in many cases, would this affect the patient in a way that they would be alerted by that system even before they start to physically feel it? Because I know when my dad was going through, you'd always say, okay, I'm getting the shakes, I'm getting like the willies, I know something's coming on. Would this actually kind of subvert that?
Oh, absolutely. We have patients who have very brittle diabetes where they don't feel their blood sugar until they're literally down on the ground, passed out.
Crashing.
These devices are fantastic because it alerts them that their blood sugars are rapidly changing or are low, so that it tells them, hey, you know what, go check your blood sugar. Let's do something about it. On the flip side, if you have a kid whose blood sugar is going too high and are getting into the dangerous territory, it alerts the parents so that, hey, you know what, let's go check your blood sugar. Let's fix this problem. The nice thing about these devices also is if you use a smartphone, it goes up and it can transmit to parents. So let's say you have a kid who's in school and they have the device on, they have a smartphone on them. This is also transmitting to their parents or their caretakers and even their teachers if you set it up that way, so that it alarms so that someone checks the child so that you don't have any significant issues in the school. It's great for the elderly too, because if the elderly person is at home while their adult children are at work, you know, the kids can call and be like, hey mom, go check your blood sugar. Hey dad, what's your blood, you know, your blood sugar is super high or super low. Let's do something about it. And so these devices are amazing for that. Now, there is a different one that has a similar filament that goes in. It's the Abbott device. It is also used here locally, but you do have to manually check your blood sugar. And so it does not have a transmitter device. And so that device you have to check, but it does share the information with whoever you need it to share with. So let's say that's what's covered by your insurance and you have that device, or it's not covered and you just have the device, and your family has it, the app uploaded on the phone, you can look and say, hey, my dad or my child hasn't checked their blood sugar in X number of hours. I'm worried. You can call in and say, hey, you haven't checked your blood sugar. Can you please check it for me now? And so this has really changed the way people treat and take care of their diabetes. I've had parents that say this is the first time in a really long time that they've been able to sleep through the night because they're not worrying about their kid and waking up at 3 a.m. to check their blood sugar just to make sure that they're not having an event while they're sleeping.
Are a lot of your patients using this particular device or this technology?
So unfortunately in Guam, although these devices, and Dr. Espinoza might be able to give you the exact timeline, have been around for many years, in Guam, we've only really had the advantage of using them in the last, I want to say about 3 years. So first was getting it onto the island. That was a struggle. Having pharmacies trying to get their distributors to bring it in. The next problem was insurance coverage. And so there were very strict regulations on when it gets covered, especially with Medicare. So that was a population. And for the longest time, all my patients were self-paying. They felt so strongly about being able to check their blood sugars that many of them were paying for the Abbott machine out of their own pockets to check their blood sugar. It really changed the quality of their lives.
Wow.
Thankfully, in the last year or so, we've had the private insurance companies covering the devices. And so we've had more and more usage of the device. It's covered in different ways depending on the insurance. Unfortunately, our Medicaid population still does not have access to this as far as I know. I could be wrong, and public health could correct me on that. But our Medicare populations and some of our locally privately insured patients do have access to this.
Now, if I may, Dr. Espinoza, yeah, because this seems, part of your work and your life's passion is innovation with underserved communities medically. This seems to be maybe a innovation of economics, of public policy and everything like that. So how do you see us maybe taking better advantage of these new innovations?
No, you're absolutely right. So Dr. Alfred is exactly right. So the CGM technology has been around for a little bit, over a decade. But it's part of it has been that adoption curve has not been so much that patients don't want it or the providers don't want to use it. It's been because of the way how healthcare works, that there's been a problem of physically, as Dr. Alfred said, physically getting it on the island, making sure that it's actually stocked by pharmacies, by various healthcare organizations. And the second is then convincing insurance companies that in fact that they should be paying for this, that it's a covered benefit. And that has lagged behind. When we think about, for example, in children, children are usually covered not by Medicare, but by Medicaid. A funny thing happens where a lot of places, so for example, in the state of California, where I am, most insurances, including Medicaid, will pay for continuous glucose monitors in children, and then they become adults and they switch the type of insurance they have and they lose their coverage for their continuous glucose monitors, which is crazy because you had somebody who was very successfully being managed with this technology. You know, they knew exactly when they were going up and they were going down, and then they lose access to this technology. That's really, again, that really is an equity problem that we need to solve in a society issue, because there's no reason that when a relatively inexpensive technology exists that can really improve outcomes, improve quality of life, why are we setting up barriers that make it hard for people to have access to that? So thankfully, as Dr. Alfred alluded, I think many of the private insurers, the commercial insurance companies on Guam, are now covering VCGM, and so slowly patients are starting to be brought onto these platforms and using these technologies. And I think we'd love to work with Medicaid and sort of in public health to make sure that they're able to do that too. One of the things that we hope to be able to accomplish with doing our validation study here on Guam is also to have it be sort of a proving ground that yes, in fact, this technology does improve outcomes for patients living with diabetes. And that should be all you need to make a decision that yes, we should cover these devices and we should provide them to patients because it really generally makes a difference.
Sure.
And I think that that's the direction where people are going, but unfortunately, where healthcare is a slow-moving beast, and so it's we're all taking little steps and we're making progress. And the good thing is I think that everyone is aligned and realizing that there's a problem, there's a potential solution. How do we get that solution into the hands of the people?
Especially Dr. Alfred, given that diabetes, and I would say you're one of the foremost voices in Guam's medical community about how prevalent this disease is in our island community. I mean, you see it every day. Undoubtedly, people, you're related to people here who have diabetes, people that care for diabetics and everything. So without trying to get into much of the political side of it and everything like that, how do we basically take this supporting argument that says there is a absolute demand for this and there is like a solution, how can we like implement this to the better treatment of our people?
It's been an uphill battle. When I first came to Guam 10 years ago, one of the private insurance companies were only covering the blood sugar testing kit at 50%. This is the glucometers and the test strips. Just so you have a good idea, that means the patient's copay was somewhere between $70 and $80 a month if they were to check their blood sugar 3 times a day. This was unaffordable and remains unaffordable for many of my patients. And this is just a little old-fashioned kit where you poke your finger and check your blood sugars. It took a very long argument with that particular insurance company to acknowledge that it really wasn't considered covered at only 50%. And it was only a specific brand that was rather expensive. And so it's really just advocating for the patients. I was finally able to convince them that they needed to cover a heck of a lot more than 50% to make it affordable for the patients. Thankfully, after enough harassment, they agreed to it. And, it also, again, with the Abbott machine, they're not that expensive, and the equivalent of checking your blood sugars with a nicer blood sugar testing kit, 3 to 4 times a day, the cost is about the same. And so it's been a 3-year argument for this to get covered, and now it's finally getting covered. Thankfully, with one of the insurances, their chief medical officer came up to me, asked me what the deal was. I explained it to them, and they were kind enough to expand the coverage, not just to insulin requiring patients, but to patients on even oral medications, as long as they take part in their diabetes wellness programs. And so I think the insurances are getting a little more open-minded about it. It's definitely a cost versus benefit ratio. And we always have to remember that diabetes is a long-term disease that can cause a lot of complications if not managed properly. And so nipping it in the bud early and getting really good glucose control and getting very good lifestyle changes at the beginning prevents all the costs in the future. It may cost you more in the beginning to be checking your blood sugars more, but in the long term, checking your blood sugars sure as heck is a lot cheaper than having a quadruple bypass that you have to be flown out to California for. So if you look at the grand scheme of things, checking your blood sugar is a cheap and effective way of controlling a long-term complex disease process and preventing changes to the person's body that leads to both poor quality of life, if not treated properly, and all these really expensive treatments that may be needed in the future.
Absolutely. Yeah, I think I really like that answer, Dr. Alfred. And I think what you touched upon is this issue that I think one thing that we don't do well in healthcare is plan for long-term chronic diseases, right? Because chronic diseases don't fit our traditional business models. And I'm using business model here loosely because I think it's true of both sort of public insurances like Medicaid and Medicare, and it's true of private insurances, commercial insurances. That we think about money that we collected now, whether that's taxes or insurance premiums, and we think about money that we have to pay now, benefits. But for diseases like diabetes, where it's, yes, you can spend the money today, but you're going to reap the benefit in 5 years, or 10 years, or 15 years. And the benefit is that patient will not need a kidney transplant or will not need a quadruple bypass. And so we don't have a great way to capture the value of that financially. That makes sense to the payers, again, whether it's government or private insurers. So one of the things that we would benefit from as a healthcare system is better aligning the incentives, right? Healthy people means that overall healthcare costs less. And so if we can somehow make that make sense and have a benefit to everyone now, then I think that's the right direction for us to go. And diabetes is a perfect case study for that, right? These devices, when we say that they're inexpensive, they're a couple $100, right? But it's a couple $100 compared to these test kits that are $70, $80 that Dr. Alfred was saying that our patients are paying for. Like, again, it's not exactly a huge markup, but the difference that it makes for individual patients today.
Well, I really like what I'm hearing, because it seems like maybe the overall summary is, things aren't perfect or aren't optimal right now, but they're getting a lot better, and there is progress, and certainly AI health is here, and you got a lot of really, really smart, dedicated, committed people that genuinely care and everything like that, and they've got Guam's back. I don't think that cannot be disputed at all.
Can I just say, when I first came home to Guam, people were still drawing up insulin in a vial and using a syringe to inject themselves. No one had thought to even ask the pharmacies to bring in the insulin pens. I was just blown away. I had never seen a person using a vial and syringe at home. At the hospital, yes, but definitely not at home. So it just blew me away that people were still pulling it up with a syringe. And so I walked over to the pharmacy and I said, why don't we have insulin pens on Guam? And the answer was, well, no one's asked for it. So as soon as I had them order, everyone else is now, it's very rare for me to see someone who's on a vial and syringe. And these are usually people who've been on insulin for over 10 years and are elderly and just don't want to make that change. But now it's almost, I hardly ever see people using a vial and syringe anymore. Well, certain insurances won't pay for the pen, but the private insurances definitely, and Medicare patients are definitely on insulin pens, which is so much easier to use, so much more accurate, and just improves your quality of life, not having to lug that around.
Well, it's like, how does innovation begin? By asking the right question. And I guess.
Absolutely.
Yeah. All right. Well, we got to wrap up and everything. Bree, maybe some final thoughts?
No, I just wanted to thank you first, Dr. Espinosa and Dr. Alford, for joining us today. I know we're going to be talking with you a little bit later in the week. Thank you so much for your time. Joining us tomorrow will be Dr. David Klonoff. He's known as the founding father of diabetes technology. He's also an advisor for AI Health. Also joining us in the Zoom room tomorrow will be Dr. Francisco Pascual. He'll be joining us from Atlanta, Georgia. He also is an AI health advisor. He's been focused on the future of diabetes technology in the hospital and how to accelerate its usability and adoption. And of course, as we've mentioned and you've seen, what we talked about on the link, this Friday, everything will culminate in a virtual town hall meeting, and you definitely do not want to miss that.
All right, so Dr. Erica Alford and Dr. Juan Espinosa, thank you so much for your insight and for sharing the passion that you both clearly have for making sure that we're well here. We do sincerely appreciate it.
Yeah, no, it's our pleasure. And we just appreciate how much work that you guys are doing to help raise awareness about diabetes and opportunities to support the community here in Guam. So thank you for the part that you're playing.
All right.
Thank you.
All right, Dr.
Thank
Alford,
you so much. It's always a pleasure. Thank you.
All right,
We'll
thank
see
you so
you guys.
much.
Stay tuned. The link continues after the break.
A Healthier You, Making Diabetes History on Guam.
Presented in partnership with Kalu Select Care and Paradise Fitness Center.